Be ready for dictation. 5 seconds to go. Start. Honorable Chairman Sir, first of all, I thank Professor Jha for having brought up this subject. He has brought up not just the subject of health, but also the voices, the anguish, and the pain of the poor and the middle class people who suffer because of lack of quality health care. Miss Rajni just mentioned what she had to undergo in an emergency. Despite being a member of parliament, I think we have something to learn from what she spoke here. Even I have introduced a bill in this house called the Universal Healthcare Bill 2021. As mentioned by many members here, Article 21 says that the right to life includes the right to health. But I think we need to make a distinction here. We need to provide more emphasis to the right to health because without that, the entire country is suffering. If the country has to enjoy real wealth, it has to be in good mental and physical health. The population of a nation can be productive only if its individuals are physically and mentally healthy. The only place where you have to live is your body, so it should be taken care of. Unfortunately, the current healthcare system in India reflects an economic and a social gap in accessing quality healthcare and draws attention to further measures that are required to be taken by the central government to assure health to all its citizens. Just as the Right to Education Act was passed for providing free and compulsory education to all the children of the country, a bill on the right to health must be brought in the House. If this bill is not accepted, the government must come in with the bill providing free health care to all the citizens of India. Several honorable members have already mentioned that the expenditure on health is only 1.4% of the gross domestic product. My honorable friend Dr. Rao said that it should be at least 6%. I agree with him that we need to increase the expenditure on health. Unless it is done, we cannot provide the huge population of India the relief from health problems that they go through. The out of pocket payments are the predominant mode for financing healthcare in the country. It should not be there when 70% of our population is below poverty line. Our subsidy itself indicates how poor our country is. Here, out of pocket expenses are so high that we need to really think about it. This is grossly unfair and exposes a large number of households to catastrophic health expenditure, which has been a major factor for rural and urban debt, as mentioned by my colleagues. We have also spoken about the pandemic here. The pandemic has exposed many gaps. Many of us have spoken about the way it was handled, but I would like to speak about certain acts of nobility, acts of human service, and acts of sacrifice. There were many people who came forward to do that. At the same time, there were terrible acts of exploitation of poor patients or rich patients by the hospitals during that time. What was happening was that people were dying and their economic resources were spent on these hospitals, and the future generations also suffered because the complete economy of the household collapsed during the times of pandemic. We must pay attention to this because we cannot allow a country to be ruined. Whenever there is a time of emergency, hospitals come in to exploit people. I think there has to be an end to this by the government. This can be done by a collaborative approach, aligning the existing government schemes, the interest of the payers and the service providers, along with innovative partnerships. We have the Ayushman Bharat scheme. Presently, it is only for inpatient and there is no outpatient coverage. The primary health care must be included here. There is one more lacuna in the system towards which I would like to draw the attention of the minister. In the hospital, when a patient is being treated and the family member goes to ask the doctor what is wrong with the patient, the doctor gives no answer. The family member does not know what is happening to the patient, what the diagnosis is, or what kind of treatment is being given to the patient. Mr. Vice Chairman, sir, I thank you for giving me the opportunity to share a few of my thoughts on the proposed amendments to the Weapons of Mass Destruction and Their Delivery Systems Act 2005. There have not been any amendments to the Act in the last 16 years of its inception, and I appreciate the introduction of such an important piece of legislation in the Parliament. Sir, I would like to share a few of my observations regarding the measures taken by the Centre in this regard. The first point is that India has remained on the forefront in matters of disarmament and reiterated the belief that nuclear weapons should be abolished in a step by step process, which is echoed in the bill. Having committed to the policy of no first use since the year 2003, we have repeatedly stated that the uses of nuclear weapons would be of punitive retaliation in case of an attack. This bill also promotes our global efforts towards disarmament and strengthening the non-proliferation order, like supporting the Conference of Disarmament, negotiations on an international convention prohibiting the use or threat of use of nuclear weapons, and steps to reduce the risks associated. The second point is that the United Nations Security Council resolution prevents individuals and organizations, including terrorist groups, from acquiring and spreading nuclear, chemical, and biological weapons and their means of delivery, while imposing obligations on all states regardless of their participation in existing treaties. India has fought a battle against terrorism for many decades. Thus, I wish to draw the attention to the dangers of proliferation of weapons of mass destruction as reiterated by our representatives at United Nations Security Council and request the international community to prevent possession and use of weapons of mass destruction by terrorist groups as per the recommendations of the United Nations Security Council.